My name is Tunde Holdren, and I'm the founder of Aviator Home Health, and I work as a CEO and administrator with the company. I started Aviator Home Health because my younger daughter, Naomi, was diagnosed with a deadly disease called moya moya. She had 3 strokes, and I was in a totally different field at the time, and they gave her less than a year to live. So I researched to see what we can do to save her life. So that was one of the biggest battles of my life, and we ended up in California, where we found a surgeon who was willing to operate on her. We traveled to California and stayed at the Ronald McDonald House, and she had excellent PT, physical therapists, and nurses. And while we were there, I just fell in love with the profession. I just decided that's what I want to do once she gets better. So we came back to Dallas, and I put myself through nursing school and started working in home health afterwards, and then decided to start my own home health company because of her, and then to help other people just like her to get better. She's doing great, thank you. She's actually now in competitive cheer, which is great compared to that she was in a wheelchair right after we got back from California through the strokes, and went through a lot of physical therapy. So we're very blessed that she had great doctors, great nurses, great physical therapists. So that's one of the main reasons that that's very, very important to us as Aviator Home Health, to provide excellent patient care, just like what they were providing to her. Well, from the very beginning, the patient care is the number one for the company. That was very important to me, obviously, because of my daughter and how the progress that she had. That's the type of care that we want to be known for as Aviator Home Health. So every time we hired someone, it's they were even referred, or we heard at how great they are. And that's actually how I met Dr. David Cook, who's now my business partner, that I heard a lot of great things about him. And so I asked him to join our company, and he did. His philosophy is the same, just patient care, great heart, very hardworking person, and we always go the extra mile to help patients out, even if it's just going to get something to eat, or they don't have a ride to get something from the store. We're always there to help. So when David came on board, first part-time, and then he ended up full-time, and then he actually the one who brought up another physical therapist name, who's very well known in the Dallas Metroplex by orthopedic doctors. He's got a hands of gold, Dusty Anderson, our other business partner, and it took a few months to set up a time with him to meet, but once we did, and he's all about patients as well, and so he came on board, and we actually met our medical director, Dr. Tolson, through Dusty as well. and he's the one who's in charge of he's the director of the physical therapy team. So when Dusty came on board as well, full-time, and then he became a business partner as well, the three of us just kept hiring people for the right reason. And our team from the very beginning, it was people that we know from the industry, that we knew they have a great work ethic and the heart, and in this business for the right reason. The early days, it was just kind of by myself, and just have a vision to build one of the best, or the best, home health company in the Dallas Metroplex. And so I couldn't just really go to doctors and just say to send us patients. So I kind of had to think outside of the box, and I love dancing and love being around people, and I'm a nurse myself, so I love seeing patients, and I decided to get my Zumba instructor license, and it's called Zumba Gold for seniors, to be able to teach classes for seniors. And I went to independent living facilities and asked them if I could teach free Zumba classes for the seniors in the communities. And that actually, I created the choreography, and we ended up with 50s music, and everyone loved it. I loved it myself and made lots of friends, and so ended up with 9 classes each week. And after that, we actually did a lot of events of like having parties in the independent living facilities, and we show up all the dances that we started, which now this class is actually called Forever Young. So we are really very well known in facilities with our Forever Young classes. And now we have 2 other instructors as well that are teaching in facilities. So that's kind of how it ended up that we started to grow, and we went from me starting the company to over 90 plus employees now. And patient care is number 1 for Aviator Home Health, and number 2 are employees. We love employees. We treat them like gold, because we really would not be able to do any of this without them. And so we really have a great team. We love each other like family. So if you go on our Facebook page, you will see all the pictures, and we call ourselves Aviator Family, because we are. Well, I have actually lots of great success stories, and fell in love with a lot of my patients. But the one particular lady with the diabetes is, she actually did not have any family. She lived in an independent living facility, and she did not have any family here in Texas. She was 99 years old, and when I first met her, she was not leaving her room. She seemed very depressed and just always down, and felt like she was giving up. So I spent a lot of extra time with her, and she ended up that after about 2 months, she started to go downstairs for breakfast, lunch, and dinner, when she never done that in the past. And every time she was trying to be telling me all the negative, and that why she just doesn't want to do anything, and everything that is wrong with her, to just try to make it as a positive and bring life back to her. And she just totally changed, and it was great to see her, and she got better and better, because I do believe that, and we teach that too, or actually talk about in our meetings with all the nurses and staff, that it's very important part of being as a nurse, that you go out there and just listen if they tell you some sad stories or, or they want to give up, but you also try to change that so they can think positively. And because I think it's very, very important for healing that the positive thinking. And so she became like my family, and she had my cell phone number. She called me all the time too, and one day she ended up in a hospital. I got the call that she went to the hospital, and so I went to see her every single day after work, and just to make sure that she stays positive and she's ready to come home. And all my other patients from the same facility were always giving me some messages to take to her that they miss her, and so I believe that really helped her healing, and she was back home after a week, and she's doing really good. She's 100 years old now, and just like my family.